Welcome, everybody. I think I've just already introduced myself, but for the sake of recording, I'll do it again. So my name is Cara. I'm the ESTHER Ireland coordinator, and my colleague James, who's our intern in ESTHER Ireland, is also supporting this webinar today. So thank you so much for participating, for signing up, and for your interest in this webinar, this grant round. I'm going to run through a presentation fairly quickly. And this, I hope, will provide you with the context and give you a little bit of guidance on the application process itself and a little bit of maybe what we're looking for in terms of partnerships and the approach that we take to partnership. And then at the conclusion of the presentation, if anybody has any questions, we'd be delighted to answer them, discuss them. And also at the end, I'll provide you with my email address if anybody has any further queries as you go on through the application process. So our grant round is already open since last week, and it will be open for an additional, I think in another 5 weeks from now. So the webinar will be just looking a little bit at the context and the background to ESTHER Ireland, the 2023 grant round, eligibility and requirements from those making an application, the actual application, how to go about it, and the review process that we carry out internally. New for this year, we've included a little bit extra in terms of monitoring your activities during implementation of your program. So we'll just take a quick look at that. And then finally, we'll finish up looking at the quality of partnerships and what we look for in terms of that. So ESTHER Ireland, who is ESTHER Ireland? We are an initiative of the HSE Global Health Programme. And sorry, I've just gone on there. I'll just go back, sorry. The IGHN, the Irish Global Health Network, acts as a secretariat and hosts the ESTHER Ireland programme. And what we are all about in ESTHER Ireland is facilitating and supporting Irish health services and institutions to develop partnerships with counterpart institutions in low and middle income countries. And essentially what this is institutional health partnerships. And this is what we are all about. So institutional health partnerships are about long-term institution to institution partnerships between high income and middle and low income countries. In those partnerships, they look to build capacity and strengthen health institutions in order to improve health service delivery and outcomes. As ESTHER Ireland, we provide support in a number of different ways. Technical support through learning events, such as our annual ESTHER Partnership Forum, which some of you may have participated in the past. We share resources through our newsletter, which can be signed up for through our webpage, and I'll touch on that at the end again. So our newsletter is called Partnerships Panorama. And then we also provide technical support directly to partnerships where required on issues during implementation. In addition to this, we run other events, such as at the moment, we are running some partnership clinics that look at a specific theme or a geographic area and provide support to partnerships in this area. So coming up, we'll have a partnership clinic that's focusing on mental health. We're also provide support in the area of networking, connecting with health partnerships, bringing them together, sharing learning between other health partnerships, and also bringing learning from maybe a more global platform and from other organizations that are also focused on institutional health partnerships. And then, of course, there's our grant. So the grant is administered by the Irish Global Health Network under a service level agreement with the HSE. And we have quite a bit of experience already administering this grant. Since 2014, nearly €500,000 has been awarded through this same process of the grant to 68 different partnerships. So this year, what's new? The theme for 2023 is partnerships that are contributing to health systems strengthening. So it would be an idea maybe during the process of writing your application to keep that in mind and maybe just make reference to it. I don't think you need to go to any huge lengths, but it is the theme for this year. And it's something that we like to see anyway in all of our applications. The individual grant ceiling, so the maximum amount that we will award for any one grant this year will be 8,000. And this obviously is subject to availability, the number of applications that we receive, and us receiving funding from elsewhere. Closing date is the 7th of July, so we have about another 5 weeks to go before that. And what we would stress is that do get your application in on time, because that we will not be accepting applications after that date. Grants must be spent within 12 months of disbursement, and probably it'll be around September time when you actually receive the grant. So you'd be looking at implementing your activities between September 23 and concluding by September 2024. Just to mention that all this information is also available in our guidelines, which are downloaded from our webpage. So you don't need to take extensive notes as we go along. This information will be available. So the purpose of our grant is to support institutions and their overseas counterparts, either to develop new partnerships or to innovate new projects within those partnerships. So very often grantees will come back and apply in future years for additional funding for more activities. As mentioned previously, we look at partnerships as very much a long-term process. So the building of the partnership may mean that new activities come online through time. And all grant applications should focus on relationship building and improving health outcomes. And when I say relationship building, I mean the relationship between the partners in the global north and the global south. So we divide them into band 1 and band 2, and you'll find as you go through the application process that the headings, there might be particular questions which are focused on band 1 and others that are focused on band 2, and that those applying may not need to fill out the other ones. So band 1 grants are to facilitate the development of a new partnership with a counterpart organization in a low or middle income country. And that you may apply for grants to formalize an agreement such as an MOU or develop a shared vision and action plan. Band 2 are for those that are already established partnerships. So a partnership that has been working together for more than a year and already has been formalized through an MOU. And the types of activities that would typically be funded would be to implement small-scale innovations or pilot projects, undertake activities that strengthen the working relationship between the partners, such as exchange visits, stakeholder meetings, that type of activity, or else to maybe build the capacity within the partnership to enable it to deliver on its projects, programs, or activities. So then in terms of eligibility and requirements, who can apply for the grant? This grant is open to health institutions such as hospitals, primary care services, public health units, education and training organizations, universities, and government health departments. So institutions that are already delivering on health, but NGOs are not eligible to apply unless they themselves have a working relationship and can apply through a fellow health institution as listed above. The criteria is similar to criteria in other years. So we do have some priority countries, and these are aligned with our partners. So our funding from Irish Aid, and then our close relationship with the HSE. So the Irish Aid priority countries are Mozambique, Ethiopia, Tanzania, Liberia, Zambia, Malawi, and Uganda. And then the HSE have formal agreements in place with Mozambique, Sudan, Zambia, and Sierra Leone. We would probably give some preference to these particular countries, but I would say that if you have a partnership that is in another country, please don't let this deter you in any way. We have and do fund plenty of partnerships outside of these priority countries. What are we looking for? We're looking for the potential to achieve impact. what is this partnership going to bring? We would like to see partnerships that strengthen the capacity of health institutions to address local health priorities and unmet health service needs, that contribute to health system strengthening and universal health coverage. For those of you that are familiar with the Irish Aid Development Policy, A Better World, we want to see coherence with that policy. It's quite likely that it's already there, but if you take a look at the document, it might be useful as well, just to make reference to it. We want to see a demonstrable theory of change. So how do you see that your activities are going to result in that impact? Now, we have a document that's embedded in the application system, the Common Grant application system, that I'll speak about in a few minutes, that will talk about developing a theory of change, and that will give you really good guidance on that. And we also want to see value for money, and co-funding is seen as advantageous. So what will we fund? The types of activities that we'll fund include needs assessment, travel, accommodation for those trips, for those exchange visits, communication activities, workshops for partnership development, subsistence allowance at local rates, publication and development of web pages to enhance partnership, and as well as monitoring and reporting costs. What will not be funded, so please don't put it into the application in terms of the funding, will be any salaries or top-ups to salaries, first-class business travel, fundraising activities, backstopping other grants, university fees, volunteer funding, consultants, office space, and sitting allowances, as well as entertainment costs. So these are actually listed in that document that I mentioned that's available on our webpage, so you don't need to take note of them. In terms of the application itself, like, what do we see as a strong application and what do we see as maybe a slightly weaker one? We want to see that you're building on existing links and with institutional commitment, so that those relationships in country are in line as well with the priorities of the country, that they're linked in and embedded with the processes which are already taking place, that they're demand driven and needs based, and based on the needs that are identified and articulated by your partner in the lower middle income country. That they're country owned and aligned with partner priorities, that you've clear goals, result focused, with a strong potential for impact, so that we can really, like when reading an application, we can see, okay, it's really clear what it is that you're trying to achieve and how you're going to achieve it. That you're guided by the need for sustainability, and that there's evidence of mutual accountability. In terms of what would be less likely to be funded, where you're just looking at one-sided benefits, we really want to see those reciprocal benefits for both partners in the work planned, where there's unclear partner capacity and experience. So both partners really must have the capacity to implement the activities and to take responsibility for the implementation of the activities and monitoring the budget. Where institutional involvement is not well articulated, where projects are overambitious with little attention to sustainability, overly project focused rather than partnership focused. And this comes back to what we've mentioned before, that really when we're looking at institutional health partnerships, we're talking about long-term relationships, building slowly, moving towards something which is going to be sustainable and impactful in the long term, and not just a very small in and out project that wouldn't really be what we were looking for. Inconsistent budget with weak focus on goals or results, and some applications we find aren't supported by the necessary documents. So just make sure that you're meeting all of those. So in terms of the application and review process, we use what's called the Common Grant application system. So this is an online site that manages the application process for us. And we have a short video on our grant webpage, which just shows you how to actually go about setting up an account. It's very simple, but you just register for an account and then you search for the ESTHER Ireland Open Grant. And when you start to apply for that, then all the questions will come up page by page, and it will be saved within that system. And when you submit it, only then do we have access to it, and we can see it. So you can work away on that, and you can work on several drafts and keep going back to it just by logging in with your own password. And then as long as you submit by the deadline, we will receive that. So this is just the homepage, just to show you for common grant application. Again, there's a link on our webpage, but that's just what you'll see. And you'll see there, it says log in or sign up. So if this is your first grant, you'll be signing up and opening up an account. So in terms of what's actually in that application process, what questions you'll be asked, there's a little bit about the context. We want to know the country context and the context of the relationship between the partners. How did this partnership come about? And, you know, why have you chosen to work together? What changes we've made for this grant round is we've actually reduced the word count on these questions. So we don't want a huge amount of text. It's really just to be clear and succinct, providing us with the context so that we can very quickly understand where this partnership has come from. We want to look at goals, objectives, and outputs to see that your plan for the project is coherent with what you're hoping to achieve. There's a question in there about risk, and what we mean by risk is really that you and your partner have jointly assessed what are the risks on for the organization and for the individuals involved. So maybe you'll do a risk assessment, identify who's liable for what, and have in place, I guess, some safeguards against those risks that you've identified, such as procedures, checklists. You might consider insurance, is that necessary? But just to have in mind that you have looked at the risks of these activities and prepared yourself to minimize those. In everything, what we care a lot about is the actual partnership itself. So obviously the end result and strengthening health systems is very important, but how you get there is equally important for us. And development of the partnership, how the partners work together, the relationship, the trust that's built up between the partners is really, really important. And we have developed what's called the EFFECT tool, covered a little bit later. And we see this as a really helpful way that the partners can come together to examine their relationships and look at maybe the power dynamic between them. Another thing that we like to see and would love to hear about is the benefits also to the Irish partner or the Irish health system. And maybe when you're really focused on the project, you're really focused on what you're going to do in country, but sometimes those benefits can be really quite simple. I've talking recently with an existing partner of the ESTHER program about benefits, and this partner is a GP practice in Ireland. And one of the lovely things they said was that really they found that because they have shared with their whole community all of the patients that come into their practice, what they're doing in their overseas partnership, they feel like the community is really involved. They've created much more awareness that everybody's on board, and it's really part and parcel of what they do in their daily work. They also found that they had huge learning because they were with the projects that they were implementing in Malawi. It was they were working in a low resource setting. And they realized that there's so much learning for them in their Irish setting because resources are still always have a limit point. And they found ways to use resources better, and maybe upskill different people in the office to do other roles that they maybe wouldn't have taken on before. So it's just something to really think about in your project. What are the benefits for yourselves as the Irish partner and the Irish health system? Supporting documentation to be included, you can be uploaded into the site as well. So letters of support from each of the partner organisations. If you are band 2, so an established partnership, you'll be required to develop a theory of change, and then all applicants will provide a draft budget. So when we receive the applications, they are reviewed jointly by the HSE Global Health Programme and also by the Irish Global Health Network. The comments and recommendations of these reviewers will then be shared with an external advisor to the HSE Global Health Programme. And then a final decision is taken by the HSE Global Health Programme Management Team. So it's quite a robust process for evaluating the proposals that have come in. So to give you an idea of the timeline for this year, grant round closes on the 7th of July. By the end of August, we would expect that all applicants will be notified of the outcome of their application, and that by the end of September, could be earlier, that we will have dispersed 90% of the grant. So 90% upfront and then 10% on completion of your final report. So you'll have a year to implement your activities, and then 6 weeks from finalising your activities to submit your final report and receive the final 10%. Now, all these timings are estimates at the moment, and they're also subject to availability of funding. So in terms of monitoring and reporting your partnership activities, we've made some changes again for this year to really just be a little bit more robust in terms of quantitative data. So application templates will require articulation of goals, objectives, and outputs. And what's new for this year is to include some indicators to measure your achievement. We would hope that those indicators would be very simple, just kind of maybe succinct and clear, and just giving us an idea of what you hope to achieve, and then those targets being reported on at the time of reporting. So I think most of you will be familiar with writing proposals in this way, but keeping in mind that the goal is that overall broad health issue that the project will contribute to, but may not have full responsibility for, but just that the objectives will be contributing and adding to the outcomes of that goal. Objectives are the longer term changes that are a result of health partnership intervention. And then outputs. So this will be much more relating to the day-to-day activities of the project. And for indicators, we're looking for SMART indicators: specific, measurable, achievable, relevant, and time-bound. So really just to be clear and succinct about what it is you're going to achieve. So here we just have a little example of a goal and indicators. So reduced morbidity, mortality, and stigma associated with chronic disease in Region A and Region B of our KCA. And the indicator for this is number of patients with hypertension and diabetes started on treatment. Another indicator, 50% of epilepsy patients are seizure-free. That the outcome level, improved access to treatment for chronic diseases, and an indicator for that will be increase in number of patients receiving treatment, rate of default from follow-up. So for all of your indicators then, just to have a target as well. If any applicant is having difficulty with this, we would encourage you to please just get in touch, and we can provide you with some one-on-one support for this. And this will just be how it looks when you're in Common Grant. This is what you'll see where you're asked for these questions. So objectives, what specific changes do you expect to see within a year? And the indicators and targets relating to those objectives, and then giving an indication of who's actually going to collect this data. It's a really useful tool for your planning, hopefully, and who will do the data analysis. So on submission of your application, you'll have a draft budget in there, and any adjustments to the budget subsequent to signing the grant would need to come back to us. If there's any changes in how you're going to spend that grant, you can just send us an email, get in touch, let us know, and we will hopefully be able to give you approval for any changes such as that. And at the point of reporting, we'll be looking for supporting evidence of expenditure. So any receipts, any invoices relating to how you've spent the grant. Okay, so finally, just to briefly look at quality of partnerships and how we view that. Really, I think that's the essence of the ESTHER programme, is how the partnership operates, the approach to partnership, the ethics involved in that. And we have plenty of tools that we hope are useful for engaging in partnership, that can kind of guide that partnership and can be used as tools as you go along to work with your partner and to improve that partnership. So there's the ESTHER Charter for Quality Partnerships, the EFFECT tool, and also a accreditation tool. So just looking at the Charter for Quality Partnerships, these are the principles that have come up before in this presentation as well. So adherence to national policies and strategies. So partners are following a country partners demand-driven process. That there's formal agreements between twinned institutions, that it's not just focused on an individual in one country and an individual in another country, but much broader than that. It's the organizations formally partnering together. And for those that are applying for Band 1 grants, really that's a great time to be able to put your MOU or similar type of agreement in place. Another principle is reciprocity. So partner institutions must be equally involved in the whole project planning, development, implementation, and review process. That there's joint and equal responsibility for implementation of the activities of the partnership and for the partnership itself. That both partners have the capability or the capacity to manage the grant, to implement the activities. That there's equity and respect between the partners, transparency in the activities that are funded through this grant and through the partnership, so that these activities are, and the funding of them are made public, and that there's adherence to ethics throughout the process. So a tool that has been developed in order to help you work with your partner and maybe delve deeper into some of these issues of power and reciprocity and equality is the EFFECT tool. So this is you can download from the ESTHER Ireland website, a self-assessment version. It takes, I think, about 20 or 30 minutes to go through, and it encourages both partners to reflect on and evaluate their roles within the partnership. So I think everything that we're trying to do here is moving away from that traditional expectation that the northern partner automatically leads the project, that they're the one coming with the money and therefore they are more powerful or have a greater say, and instead support the notion of an equally balanced relationship or equality in the partnership. So these are just some of the areas of questioning. So implementing best practice, when you are carrying out your needs assessment, identification of the needs for the partner initiative, who was involved in it? That's what this question is really asking. So reflecting on this can hopefully help you identify areas where things can be improved upon. And so on. You can see just the other areas of change there. And finally, we have an accreditation tool, which is relatively new, and this is designed to allow partners to self-assess their adherence to each key principle for quality of partnerships. That self-assessment is then reviewed by the ESTHER team, and those partners that are successful in gaining the accreditation are awarded a written letter and a plaque. So this is to be renewed every 2 years. But it really is kind of like an opportunity to celebrate partnership that is working well and has, I suppose, been diligent in constantly challenging that inherent power dynamic that is there. So that concludes the presentation. Just to point you in the direction of further resource and information, most of you hopefully will come across the ESTHER Ireland website, the Irish Global Health Network website as well. We both have newsletters that are full of information that I think are relevant to all of you in this field. So the ESTHER Ireland newsletter is called Partnership Panorama. And both of these newsletters can be signed up for at the very bottom of any of our web pages. So if you log onto the website and scroll down to the very bottom, you can find a space where to sign up. And then for any questions which aren't answered today, I'll open the floor now for anybody who has any questions. But for any further questions or queries, and later on as you're going through the application process, feel free to email me. So it's just cara@globalhealth.ie.